Hello, my name is Dr. Barbara Rodman and I'm at the Back to Health Wellness Center in Ottawa, Ontario. I want to talk to you about throwing your back out. I've been in practice over 28 years and a week doesn't go by where somebody doesn't come in and they're like, "Hey doc, I'm like stuck sideways because I threw my back out." How does it happen? So that's usually down in this area, your low back. There's actually 5 vertebrae in your low back. The bottom one is here, the 5th, the 4th, the 3rd, the 2nd, and the 1st. And what happens is usually how you throw it out has to do with trauma over time, micro traumas to your low back. And what happens is we're not the best as a society with bending properly. So I'm going to demonstrate with bending my knees so I don't throw my back out, but people bend over to pick things up without bending, and they also rotate this way. So you think about shoveling, gardening, picking up pieces of paper, tying your shoes even, it happens with. And over time, as you keep doing that, you actually put a lot of pressure down through here. So if you're bending over without bending in that fashion, you actually put up to 150% pressure on these, what we call weight-bearing joints of the lower back. And over time, it actually will cause it just one day when you go to actually maybe turn to reach for something and you're like, I got a back spasm. And what happens is you put these 2 joints, the 4th and 5th lumbar, out of alignment. And when that happens, there's little nerves that go in between the vertebrae. And these nerves go, ow, that hurts when you actually shift it because then they're being pinched. And when they get pinched in that fashion, they will cause the muscles to tighten on that side and you get back spasms. So that's why you come in crooked like that, because you'll get a big spasm on one side. And the patient once called it a question mark. They felt like a question mark because you get this big back spasm. It's trying to guard for you. So how do you get rid of it? Because then you're stuck and it's painful. Could shoot stuff down your leg or just stay in that area. The best things for it are to get into a chiropractor to have it worked on. You often think because it's so painful and you're stuck, you're not able to, but the sooner you can, the easier it is to actually fix. And normally with it, what I like to do here is I call it ingredients to a recipe. We use a machine known as the interferential current unit to pulse a current through there to help relax the nerve receptor fibers from these nerves, and that'll help tone the muscles down so they stop spasming as much, because we got to get them looser to be able to get in and do stuff to those vertebrae. Then often we can either with the muscles use a static type of work called trigger point therapy, where we go in and just hold the muscle to release the tension in it, because it's as if it tied knots in itself. So if you took an elastic band and tied knots, it would be shorter and tighter, and tie some really huge ones in it for a back spasm. Or you do it in an active way with actively releasing it. And after we've done that, when everything is actually a bit looser in there, we can get in and take these joints that have gone like out of alignment like this and put them back into alignment. And depending on how painful you are with it, so a gentleman who came in yesterday, one type of adjustment he wouldn't be able to tolerate yesterday, so I used a different style. So there's a number of different styles that we can actually do depending on how much pain you're still in after we do the other stuff. Another gentleman who came in last week after we did all the other prep work, I was able to get in and adjust a certain way. He was back in yesterday and he's actually virtually pain-free now, and he's not a question mark anymore. So what else do you do for it while it's happening? We don't want the muscles to keep spasming, because after you've had that work done, your body wants to actually then go guard that again, because it's trying to guard and hold it, and it's like, and then it'll make you go crooked again. So I do find that if I send you home, or if you have one with a back brace, and these back braces, people think of them just for lifting, but they can be used for day-to-day use with gardening or just when you have different issues. And I'll put it on a patient and I'll get them to wear it. And when you do that, then the muscles, it's allowing the muscles to rest so they won't guard as much. Some people think of this as almost like a cast where it could weaken things. It doesn't. It actually helps retrain things. So in a sense, you could wear it 24 hours a day, 7 days a week, for a whole year, take it off, and all you've done is helped actually retrain your whole system here, because with it on, you're able to still move around and bend and things. So it's not like a cast where you're immobilizing the area. And if somebody's in a lot of pain and crooked, I'll have them wear this 24 hours a day, even sleeping. They just, while they're sleeping or sitting, just loosen it a little bit. And the nice thing with this is, because people often say, should I ice or should I heat it? Since it's a back spasm, should I be heating it? No. Because the problem with heating is you actually cause a greater inflammatory process in those muscles to tighten more. You actually want to ice it. So the nice thing is you take a nice ice pack. You get a good one if you have one, or use a bag of peas or corn, and you can tuck it inside here and be able to ice. And usually ice is best 20 minutes every hour, as much as you can initially. So, and then when you sleep, what you want to do is either sleep on your back with a pillow underneath your knees, or on your side with it between your knees. Some people find hard surfaces are great, so you might want to try to sleep down on the ground with a blanket. It's just difficult in the morning, because mornings are the hardest on this problem. When you get up in the morning, it's painful. So it will be hard to get off the floor. When you get out of bed, just take some time. If somebody lives with you, go get them to get the ice pack so you can ice it beforehand. And while you're lying down, just do some shifting back and forth of your back to loosen it up, because what I say is you want to try to get some motion in it, because motion is lotion. So you could actually do this type of movement. It's difficult to stretch these types of problems because you could cause the muscle to spasm more and cause the joint to go out of alignment more. So you're better to do a movement exercise such as this, and it'll help things. When you're lying down, you could do it where you bend your knees up and you just twist them back and forth. It's like a windmill type motion. So you'd be lying on your back doing that. So remember, mornings are the hardest. Medication, because people think, oh, should I take something? It's not going to solve the problem, but you can take it in concert with everything else that you do. Do not do just bed rest, because you think it feels okay because you're not moving, but that will weaken and cause tightness in things, and that can cause problems down the road with it where it causes more scar tissue. You got to get in and get it worked on right away so that everything doesn't bind up there and cause issues with it. And it is quick to treat if you get it fixed right away, so you should be trying to do that. Later, as things progress with it, I'll often give some stretching once the muscle isn't spasming as much, or muscles, depending on how many they are. One thing to remember too, because this happens often where people don't let pain be your guide, because a lot of people think, oh, I'm not in pain anymore, so I can go out and I can do this and I can do that and I can do this, and then all of a sudden it's like bam. They're actually right back where they were or worse. Because I had a woman once who, she felt great. So on Friday, she went to the gym to work out. She went home and did some cleaning. The next morning, she got up and she had a run. And then after that, she was back to where she was, but even a bit worse. And that time, the second time, took more to actually fix for her. So remember, if you have any questions, feel free to email me or come by and I can give you a hand. We're great with getting emergencies in all the time too, so good luck.